This is my well advice for all girls as they transition from girl to woman. It encompasses everything from preventative medicine to all the changes that are going to be happening in them and in our families. My name is Dr. Monica Flores, a pediatrician in South Florida since 2001, and today we're talking about the well visit for adolescent teenage girls. I usually start by saying everybody should brush their teeth twice a day, go to the dentist twice a year, no smoking, no drinking, no drugs. Vaping is also smoking, so we want to stay away from vaping, and we also want to stay away from people who are choosing to do those things. So if your friends start to choose to smoke or drink or do drugs, please try to either find new friend groups, influence them to not make those changes, but if you can't, then try to find places where you feel safe. If we are starting to think about dating, we want to talk to mom and dad about it, and mom and dad, we need to talk to them about it. We need to make sure that they know what expectations that we have. I like kids to stay in the back seat. At 14, then they can sit in the front seat. That way they can start to learn the rules of the road. They should be off their phone and paying attention, and mom and dad, you should be talking to them about what expectations you have and what rules that you know, so that as they get ready to start driving on their own. Always wear a seatbelt. We make sure that we're sleeping well. Things that help to influence good growth in height is making sure that we're eating health. Half a plate full of fruits and vegetables, quarter plate of protein, and a quarter plate whole grains for all your meals, all your snacks, and at least half a gallon of water a day, even up to a full gallon, especially if you're doing sports. Avoiding juice, avoiding soda, no cereal, and making sure that we exercise. The more that we eat healthy, exercise, and sleep, the taller we'll grow and we'll reach our genetic potential. Usually, puberty will start as young as the age of 8, and the first thing that should happen is breast development. If we have pubic hair, stinky armpits, or hair in other places before boobs start, then that can be a worry. Once you start boobs, then 2 to 3 years later, that's when periods start. If it's too fast, if all of a sudden you have boobs and 6 months from now you have pubic hair, stinkiness, and everything seems like it's happening too quickly, that's another reason to be concerned and make sure that we bring it up to the doctors. Once young ladies start their period, the first 2 years of their periods can be irregular. 1 month, yes, the next month, no. Twice in 1 month. Or maybe they skipped 3 months, and that's completely normal for the first 2 years. Periods should always last only 3 to 7 days. I like to keep a period app so that we can kind of keep track of when the periods are going to come. And there could be some pain, some discomfort, but nothing should be so that you're not missing school, you're getting nausea, you're getting vomiting, you're getting dizziness. If you're having any of those symptoms, that's abnormal. If your periods are becoming too frequent, every 2 weeks you're having a period, or your period is lasting more than 7 days, or if you're getting clots, you're getting too much blood flow, you're constantly having staining or issues, then I need to know about it right away. Once you've had your periods, their rate of growth will start to decrease, and some ladies stop growing altogether. For boobs, we don't have to worry about breast cancer until after the age of 18. If we feel a lump or a bump before the age of 18, just wait a week, see if it goes away. If it's still there, let me know. If it's not, it's usually not a big deal. We don't really have to go through breast self-exams on a monthly basis just because we have boobs. The risk of cancer increases after 18. So I like the 17-year-olds to kind of start getting used to doing it on a regular basis, remembering always that there's breast muscles underneath your clavicle, and that we have to check underneath the armpits to make sure that there's no lumps or bumps there, because that's where the boobs will drain. Your boobs should never have discharge, never have water, milk, or blood that comes out of it. And if that ever happens, that's an emergency. Could be something wrong with your thyroid, with the hormones from your brain, lots of different things. So that's definitely an emergency. But vaginal discharge is completely normal. Clear, milky, goes on the panty, stains it yellow, starts before your periods, probably the year before you start your periods, feels like slime, feels like you got wet stuff down there. If it ever itches, stings, or burns, let me know. If it's happening and it's bothering you, just put a patty liner in and call it a day. That's pretty much all the information that I give my adolescent girls during their physical. And if there's any questions or concerns, then we dive deeper into whatever they bring up to us. Thanks so much.